Question 1. A 46-year-old client with a history of untreated hyperthyroidism is brought to the emergency department with a temperature of 104.9 degrees Fahrenheit 40.5 degrees Celsius, heart rate of 148 per minute, agitation, vomiting, and diarrhea. Blood pressure is 168/92 mmHg. The nurse recognizes these findings as most consistent with which condition, and what is the priority initial intervention? A. Myxedema coma, administer 4 levothyroxine immediately. B. Thyroid storm. Initiate cooling measures and administer beta blockers. C. Thyroid storm, restrict fluids to prevent overload. D. Myxedema coma, apply warming blankets rapidly. Answer. B. Thyroid storm, initiate cooling measures and administer beta blockers. Rationale. Severe hyperthermia, tachycardia, and CNS agitation indicate thyroid storm. Priority is reducing sympathetic overactivity and temperature. Rapid warming is contraindicated in myxedema, and fluid restriction is unsafe. Question 2. A 72-year-old client is admitted during winter with hypothermia, 94 degrees Fahrenheit, 34.4 degrees Celsius, bradycardia, 48 per minute, hypotension, and decreased level of consciousness. The client has a history of hypothyroidism and stopped taking medication. Which physician order should the nurse question first? A. Administer 4 levothyroxine. B. Initiate passive rewarming. C. Apply electric heating blanket at high setting. D. Administer 4 fluids. Answer. C. Apply electric heating blanket at high setting. Rationale. Myxedema coma requires gradual rewarming. Rapid warming causes vasodilation, cardiovascular collapse. Other interventions are appropriate. Question 3. A client with thyroid storm is prescribed propranolol. Which assessment finding indicates the medication is effective? A. Increased urine output. B. Decreased heart rate from 150 per minute to 100 per minute. C. Increased level of consciousness. D. Reduction in edema. Answer. B. Decreased heart rate from 150 per minute to 100 per minute. Rationale. Beta blockers reduce sympathetic effects, especially tachycardia, key in thyroid storm stabilization. Question 4. A client in myxedema coma has the following ABG results: pH 7.28, PaCO2 58 mm of mercury, HCO 326 milliequivalent/L. Which intervention is the priority? A. Administer sodium bicarbonate. B. Encourage deep breathing exercises. C. Prepare for mechanical ventilation. D. Administer diuretics. Answer. C. Prepare for mechanical ventilation. Rationale. Respiratory acidosis due to hypoventilation is common in myxedema coma. Airway and ventilation support is priority. Question 5. A nurse is assessing 2 clients. Which client requires immediate intervention? A. Thyroid storm with HR 130 per minute and temp 102 degrees Fahrenheit. B. Myxedema coma with HR 50 per minute and hypothermia. C. Thyroid storm with new-onset atrial fibrillation. D. Myxedema coma with dry skin and fatigue. Answer. C. Thyroid storm with new-onset atrial fibrillation. Rationale. Atrial fibrillation significantly increases risk of stroke and hemodynamic instability, requires urgent intervention. Question 6. A client with suspected thyroid storm is receiving propylthiouracil, PTU. What is the mechanism of action relevant to this emergency? A. Increases thyroid hormone synthesis. B. Blocks peripheral conversion of T4 to T3. C. Stimulates TSH release. D. Enhances iodine uptake. Answer. B. Blocks peripheral conversion of T4 to T3. Rationale. PTU reduces active T3 levels quickly, which is critical in thyroid storm management. Question 7. A client with myxedema coma is being monitored in the ICU. Which finding indicates clinical improvement? A. Persistent hypothermia. B. Heart rate increases from 42 per minute to 64 per minute. C. Decreased responsiveness. D. Reduced urine output. Answer. B. Heart rate increases from 42 per minute to 64 per minute. Rationale. Improved cardiac output and normalization of bradycardia indicate recovery. Question 8. A nurse is preparing to administer iodine solution to a client in thyroid storm. Which is the correct nursing action? A. Administer before antithyroid medication. B. Administer at least 1 hour after antithyroid medication. C. Dilute in hot fluids. D. Give IM if patient is vomiting. Answer. B. Administer at least 1 hour after antithyroid medication. Rationale. Giving iodine after antithyroid drugs prevents new hormone synthesis and release. Question 9. A client with myxedema coma develops hyponatremia. What is the most likely cause? A. Excessive sodium intake. B. Increased ADH secretion. C. Hyperventilation. D. Increased renal excretion of sodium. Answer. B. Increased ADH secretion. Rationale. Hypothyroidism can lead to SIAD-like effects, causing dilutional hyponatremia. Question 10. A nurse is caring for a client with thyroid storm. Which intervention should be avoided? A. Administering aspirin for fever. B. Using cooling blankets. C. Providing 4 fluids. D. Administering beta blockers. Answer. A. Administering aspirin for fever. Rationale. Aspirin increases free thyroid hormone levels by displacing it from binding proteins, worsening the crisis. Question 11. A 58-year-old client with a history of hypothyroidism is admitted with suspected myxedema coma. The nurse notes hypothermia, hypotension, bradycardia, and decreased level of consciousness. Which additional assessment finding would the nurse expect? A. Warm, moist skin and tremors. B. Hyponatremia and hypoglycemia. C. Severe hypertension and tachypnea. D. Hyperactive bowel sounds and diarrhea. Answer. B. Hyponatremia and hypoglycemia. Rationale. Myxedema coma slows metabolism, decreased glucose production and dilutional hyponatremia due to increased ADH. Question 12. A client with thyroid storm is receiving aggressive treatment. Which finding indicates the client is at greatest risk for mortality? A. Temperature of 101.8 degrees Fahrenheit 38.8 degrees Celsius. B. Heart rate of 120 per minute. C. Development of heart failure symptoms. D. Mild agitation. Answer. C. Development of heart failure symptoms. Rationale. Cardiac complications, especially heart failure, are the leading cause of death in thyroid storm. Question 13. A nurse is caring for a client with myxedema coma who is receiving 4-levothyroxine. Which assessment finding requires immediate intervention? A. Heart rate increases from 50 per minute to 110 per minute. B. Temperature rises from 94 degrees Fahrenheit to 97 degrees Fahrenheit. C. Increased alertness. D. Improved urine output. Answer. A. Heart rate increases from 50 per minute to 110 per minute. Rationale. Rapid increase in heart rate suggests overtreatment risk of cardiac ischemia or arrhythmias. Question 14. A client with untreated hyperthyroidism develops thyroid storm after surgery. Which precipitating factor is most likely responsible? A. Increased iodine intake. B. Surgical stress. C. Cold exposure. D. Dehydration. Answer. B. Surgical stress. Rationale. Stress, surgery, infection, trauma, commonly precipitates thyroid storm. Question 15. A nurse is managing a client with thyroid storm who is experiencing severe agitation and confusion. Which intervention is most appropriate? A. Restrain the client immediately. B. Administer sedatives as prescribed. C. Encourage ambulation. D. Limit fluid intake. Answer. B. Administer sedatives as prescribed. Rationale. Sedatives help control CNS hyperactivity and reduce metabolic demand. Restraints may worsen agitation. Question 16. A client with myxedema coma is receiving 4 fluids. Which complication should the nurse monitor most closely? A. Fluid overload. B. Hyperkalemia. C. Metabolic alkalosis. D. Hypertension. Answer. A. Fluid overload. Rationale. Decreased cardiac function in myxedema coma increases risk for fluid overload and heart failure. Question 17. A nurse is caring for a client with thyroid storm receiving glucocorticoids. What is the primary reason for this therapy? A. Increase TSH production. B. Reduce inflammation only. C. Block peripheral conversion of T4 to T3 and treat adrenal insufficiency. D. Promote iodine excretion. Answer. C. Block peripheral conversion of T4 to T3 and treat adrenal insufficiency. Rationale. Glucocorticoids reduce active hormone levels and support adrenal function during stress. Question 18. A nurse is evaluating a client with suspected myxedema coma. Which finding helps differentiate it from thyroid storm? A. Altered mental status. B. Temperature of 95 degrees Fahrenheit 35 degrees Celsius. C. Cardiovascular instability. D. Electrolyte imbalance. Answer. B. Temperature of 95 degrees Fahrenheit 35 degrees Celsius. Rationale. Hypothermia is a hallmark of myxedema coma, whereas thyroid storm presents with hyperthermia. Question 19. A client with thyroid storm is experiencing profuse diarrhea and vomiting. Which intervention is the priority? A. Administer antiemetics only. B. Restrict oral intake. C. Initiate fluid and electrolyte replacement. D. Provide high-fiber diet. Answer. C. Initiate fluid and electrolyte replacement. Rationale. Fluid loss leads to dehydration and shock. Volume replacement is critical. Question 20. A nurse is caring for 2 endocrine crisis clients. Which task is appropriate to delegate to an experienced LPN? A. Initiating 4-levothyroxine in myxedema coma. B. Monitoring cardiac rhythm in thyroid storm. C. Assessing level of consciousness. D. Administering prescribed oral antithyroid medication. Answer. D. Administering prescribed oral antithyroid medication. Rationale. Medication administration is within LPN scope. Assessment and initiation require RN-level judgment. Question 21. A 63-year-old client with long-standing hypothyroidism is brought to the emergency department in winter after being found unresponsive at home. Vital signs: temperature 93.2 degrees Fahrenheit 34 degrees Celsius, HR 44 per minute, BP 86/50 millimeter of mercury, RR 8 per minute. Which prescription should the nurse implement first? A. Administer 4-levothyroxine. B. Apply warming blanket. C. Prepare for endotracheal intubation. D. Administer 4-dextrose. Answer. C. Prepare for endotracheal intubation. Rationale. Airway and breathing take priority. Severe hypoventilation, RR8, respiratory failure risk in myxedema coma. Question 22. A client in thyroid storm is receiving a cooling blanket. Which finding requires the nurse to intervene immediately? A. Shivering develops. B. Temperature decreases to 100.4 degrees Fahrenheit 38 degrees Celsius. C. Skin feels cool to touch. D. Mild diaphoresis. Answer. A. Shivering develops. Rationale. Shivering increases metabolic demand and heat production, worsening thyroid storm. Must be prevented. Question 23. A nurse is administering propylthiouracil, PTU, to a client in thyroid storm. Which laboratory value requires immediate reporting? A. WBC count 2000/mm superscript 3. B. Sodium 138 milliequivalent/L. C. Potassium 4.2 milliequivalent/L. D. Hemoglobin 13G/DL. Answer. A. WBC count 2000/mm superscript 3. Rationale. PTU can cause agranulocytosis, severe infection risk, life-threatening complication. Question 24. A client with myxedema coma is receiving levothyroxine therapy. Which clinical finding indicates excessive dosing? A. Bradycardia. B. Hypothermia. C. Chest pain and palpitations. D. Lethargy. Answer. C. Chest pain and palpitations. Rationale. Overreplacement can trigger hyperthyroid effects, myocardial ischemia and arrhythmias. Question 25. A client with thyroid storm develops a temperature of 105 degrees Fahrenheit 40.6 degrees Celsius. Which intervention should the nurse implement first? A. Administer acetaminophen. B. Initiate cooling measures. C. Increase 4 fluids. D. Administer antibiotics. Answer. B. Initiate cooling measures. Rationale. Extreme hyperthermia is life-threatening, rapid cooling is priority to prevent organ damage. Question 26. A nurse is caring for a client with myxedema coma. Which assessment finding indicates worsening condition? A. Increasing drowsiness progressing to unresponsiveness. B. Heart rate rising from 48 per minute to 60 per minute. C. Temperature increasing gradually. D. Improved urine output. Answer. A. Increasing drowsiness progressing to unresponsiveness. Rationale. Declining neurologic status signals worsening CNS depression, life-threatening progression. Question 27. A client admitted with thyroid storm is prescribed esmolol 4 infusion. What is the primary goal of this medication? A. Decrease thyroid hormone synthesis. B. Control tachycardia and reduce cardiac workload. C. Promote excretion of thyroid hormones. D. Increase metabolic rate. Answer. B. Control tachycardia and reduce cardiac workload. Rationale. Esmolol, short-acting beta blocker, rapidly controls heart rate, critical in preventing cardiac complications. Question 28. A nurse is assessing a client suspected of myxedema coma. Which finding is most specific to this condition? A. Fever and tachycardia. B. Hypothermia and bradycardia. C. Hypertension and agitation. D. Diarrhea and weight loss. Answer. B. Hypothermia and bradycardia. Rationale. Classic hallmark, slowed metabolism, low temperature and heart rate. Question 29. A client with thyroid storm is being treated with multiple medications. Which intervention should the nurse perform when administering iodine solution? A. Give with food to enhance absorption. B. Administer before PTU. C. Monitor for metallic taste and swelling. D. Administer rapidly for push. Answer. C. Monitor for metallic taste and swelling. Rationale. Iodine can cause toxicity, iodism, metallic taste, salivary gland swelling, mouth irritation. Question 30. A nurse is managing care for a client with myxedema coma and a client with thyroid storm. Which client should the nurse assess first? A. Thyroid storm client with HR 118 per minute and anxiety. B. Myxedema coma client with BP 90/60 mmHg and RR 10 per minute. C. Thyroid storm client with diarrhea and vomiting. D. Myxedema coma client awaiting lab results. Answer. B. Myxedema coma client with BP 90/60 mmHg and RR 10 per minute. Rationale. Hypotension and hypoventilation indicate impending respiratory and cardiovascular collapse, highest priority. Question 31. A 55-year-old client with untreated hyperthyroidism is admitted with suspected thyroid storm. The nurse notes fever, 103.6 degrees Fahrenheit, 39.8 degrees Celsius, HR 142 per minute, BP 170/88 mmHg, and extreme restlessness. Which nursing intervention has the highest priority immediately upon admission? A. Administer antipyretics. B. Place the client in a quiet, low-stimulation environment. C. Initiate continuous cardiac monitoring. D. Encourage oral fluid intake. Answer. C. Initiate continuous cardiac monitoring. Rationale. Severe tachycardia places the client at high risk for fatal arrhythmias. Cardiac monitoring is essential for early detection and intervention. Question 32. A client with myxedema coma is prescribed 4-hydrocortisone. What is the priority reason for administering this medication? A. To reduce inflammation. B. To prevent adrenal insufficiency during treatment. C. To increase metabolic rate. D. To enhance thyroid hormone absorption. Answer. B. To prevent adrenal insufficiency during treatment. Rationale. Thyroid hormone replacement can precipitate adrenal crisis if cortisol is insufficient. Steroids provide necessary support. Question 33. A nurse is caring for a client with thyroid storm who suddenly develops confusion, hypotension, and weak peripheral pulses. What is the priority nursing action? A. Administer sedatives. B. Notify the provider and prepare for aggressive supportive care. C. Continue current therapy. D. Restrict fluids. Answer. B. Notify the provider and prepare for aggressive supportive care. Rationale. These findings suggest shock and cardiovascular collapse. Rapid escalation of care is required. Question 34. A client with myxedema coma is found to have a blood glucose of 52 mg per deciliter. Which intervention should the nurse implement first? A. Administer 4-dextrose. B. Recheck glucose in 15 minutes. C. Start enteral feeding. D. Administer insulin. Answer. A. Administer 4-dextrose. Rationale. Hypoglycemia is life-threatening, immediate correction is required. Question 35. A client with thyroid storm is being treated with multiple medications. Which sequence of administration is correct for optimal therapeutic effect? A. Iodine PTU beta blocker. B. PTU iodine beta blocker. C. Beta blocker iodine PTU. D. Iodine beta blocker PTU. Answer. B. PTU iodine beta blocker. Rationale. PTU must be given before iodine to block hormone synthesis. However, beta blockers are typically initiated early and are not sequence dependent. Question 36. A nurse is assessing a client with myxedema coma. Which finding indicates improvement in respiratory status? A. PaCO2 decreases from 60 mm of mercury to 45 mm of mercury. B. Respiratory rate remains at 8 per minute. C. Oxygen saturation decreases. D. Increased lethargy. Answer. A. PaCO2 decreases from 60 mm of mercury to 45 mm of mercury. Rationale. Improved ventilation leads to normalization of CO2 levels. Question 37. A client with thyroid storm develops severe dehydration. Which clinical manifestation would the nurse expect? A. Bounding pulses. B. Decreased hematocrit. C. Hypotension and concentrated urine. D. Bradycardia. Answer. C. Hypotension and concentrated urine. Rationale. Fluid loss leads to hypovolemia, hypotension and concentrated urine due to dehydration. Question 38. A nurse is caring for a client with myxedema coma receiving passive rewarming. Which finding indicates the intervention is appropriate and effective? A. Sudden rise in temperature. B. Gradual increase in temperature over several hours. C. Development of tachycardia. D. Onset of sweating. Answer. B. Gradual increase in temperature over several hours. Rationale. Slow rewarming prevents vasodilation and cardiovascular collapse. Question 39. A client with thyroid storm is prescribed acetaminophen for fever. Why is this preferred over aspirin? A. Aspirin causes sedation. B. Aspirin reduces effectiveness of PTU. C. Aspirin increases free thyroid hormone levels. D. Aspirin causes hypoglycemia. Answer. C. Aspirin increases free thyroid hormone levels. Rationale. Aspirin displaces thyroid hormone from binding proteins, worsening thyrotoxicosis. Question 40. A nurse is prioritizing care for multiple clients. Which client requires immediate assessment? A. Thyroid storm client with HR 110 per minute and anxiety. B. Myxedema coma client with sodium 128 milliequivalent/L. C. Thyroid storm client with new chest pain. D. Myxedema coma client with dry skin and fatigue. Answer. C. Thyroid storm client with new chest pain. Rationale. Chest pain suggests myocardial ischemia, life-threatening and requires immediate intervention. Question 41. A 67-year-old client with known hypothyroidism is admitted with myxedema coma. The nurse notes, temperature 93 degrees Fahrenheit 33.9 degrees Celsius, HR 40 per minute, BP 84/48 mmHg, and oxygen saturation 88% on room air. Which intervention should the nurse implement first? A. Administer 4-levothyroxine. B. Apply passive warming measures. C. Administer oxygen and support airway. D. Start 4 fluids. Answer. C. Administer oxygen and support airway. Rationale. Airway and oxygenation take priority. Hypoxia and hypoventilation are immediate life threats in myxedema coma. Question 42. A client with thyroid storm is receiving treatment. Which finding indicates the client is responding positively to therapy? A. Persistent fever of 102 degrees Fahrenheit. B. Heart rate decreases from 140 per minute to 96 per minute. C. Continued agitation. D. Ongoing diarrhea. Answer. B. Heart rate decreases from 140 per minute to 96 per minute. Rationale. Reduction in tachycardia reflects control of excessive sympathetic stimulation. Question 43. A nurse is caring for a client with myxedema coma. Which electrolyte imbalance is the nurse most likely to monitor for? A. Hypernatremia. B. Hyponatremia. C. Hypercalcemia. D. Hyperphosphatemia. Answer. B. Hyponatremia. Rationale. Dilutional hyponatremia occurs due to increased ADH and impaired free water clearance. Question 44. A client with thyroid storm is prescribed high-dose glucocorticoids. Which outcome indicates the therapy is effective? A. Increased TSH levels. B. Decreased conversion of T4 to T3. C. Increased metabolic rate. D. Decreased iodine excretion. Answer. B. Decreased conversion of T4 to T3. Rationale. Glucocorticoids reduce peripheral conversion to active T3, improving symptoms. Question 45. A nurse is evaluating a client with myxedema coma. Which finding requires immediate intervention? A. Urine output of 25 milliliters per hour. B. Heart rate of 52 per minute. C. Respiratory rate of 8 per minute. D. Temperature of 95 degrees Fahrenheit. Answer. C. Respiratory rate of 8 per minute. Rationale. Severe hypoventilation, respiratory failure risk, priority intervention needed. Question 46. A client with thyroid storm is being treated with PTU and iodine. Which laboratory finding indicates treatment effectiveness? A. Increased T3 levels. B. Decreased T3 and T4 levels. C. Increased TSH levels. D. Elevated WBC count. Answer. B. Decreased T3 and T4 levels. Rationale. Therapy aims to reduce circulating thyroid hormones. Question 47. A nurse is caring for a client with myxedema coma who develops hypotension unresponsive to fluids. Which medication should the nurse anticipate? A. Dopamine infusion. B. Beta blocker. C. Insulin. D. Diuretic. Answer. A. Dopamine infusion. Rationale. Vasopressors are needed when hypotension persists despite fluid resuscitation. Question 48. A client with thyroid storm becomes increasingly restless and disoriented despite treatment. What is the priority nursing action? A. Encourage family presence. B. Increase environmental stimulation. C. Administer prescribed sedatives. D. Restrict fluids. Answer. C. Administer prescribed sedatives. Rationale. Sedation reduces CNS stimulation and metabolic demand. Question 49. A nurse is differentiating between thyroid storm and myxedema coma. Which finding is most indicative of thyroid storm? A. Bradycardia. B. Hypothermia. C. Severe tachycardia and hyperthermia. D. Decreased mental status. Answer. C. Severe tachycardia and hyperthermia. Rationale. Thyroid storm presents with extreme hypermetabolic state, high HR and temperature. Question 50. A nurse is managing a client with myxedema coma. Which intervention is essential to prevent complications during recovery? A. Rapid rewarming with heating pads. B. Continuous cardiac monitoring. C. Restricting fluids. D. Encouraging ambulation early. Answer. B. Continuous cardiac monitoring. Rationale. Cardiac instability is common during treatment. Monitoring helps detect arrhythmias and ischemia early.
When it comes to endocrine emergencies, the difference between thyroid storm and myxedema coma isn't just academic, it's life or death. One is a body in overdrive, burning fast and crashing hard. The other is a system shutting down, slowing to the edge of collapse. And on exam day, the NCLEX will test whether you can recognize that difference instantly and act even faster. If you made it through all 50 questions, you've just trained your brain to spot the subtle cues most candidates miss. When to cool versus when to warm, when to slow the heart versus when to support it, and most importantly, when airway and breathing override everything else. Don't stop here. Repetition builds instinct, and instinct is what wins in high-pressure questions. Go back, challenge yourself again, and aim for mastery, not just familiarity. Stay sharp, stay clinical, and keep pushing toward that pass.